Discuss about evaluation. This topic is considered in supervision and management as well as in nursing administration. So what is evaluation, what is nursing evaluation? This topic we will cover first in English and next class will be in Hindi. Let us start. Okay, what is evaluation and what are the main tools which we use for evaluation? This topic we will discuss today. Evaluation is a process which can be used in every setting, like in hospital, in nursing service, in community health, as well as in nursing education. Evaluation is a systemic and ongoing process of determining the extent to which the organizational goals or outcomes have been achieved. Means what are the outcome goals that we have achieved during this course of period in the service as well as in education. For example, if how much the student have achieved, what he or she has learned, this can be expressed by evaluation only, and there the evaluation tool will be question and answer, questioning. Okay, and while determining the service goals, to how much extent we have covered immunization or in terms of patient's outcome, this all is considered under evaluation. Evaluation is a decision-making process that leads to suggestions for the actions to improve the participants or the supervisee. Evaluation is an ongoing activity. Continuously evaluation can be done that begin at the first identification of the need for a program or activity process. Means when the program or activity starts, on the same day evaluation process also starts. Throughout the planning, it continues throughout the planning as well as implementation phases, and sometimes it extends beyond the length of the activity or program. Let us see the definition of evaluation. Evaluation is defined as the systemic acquisition and assessment process of the information to provide useful feedback about some work, about some person, about some project or situation. So this is the proper definition of evaluation, and through evaluation only we can find out the skill of a person, the goals which we have achieved during a service or activity. What are the objectives or goals of evaluation? The objectives of evaluation is to determine the participants' progress towards achievement of the goals of the program, and it also facilitates the maintenance of strength and elimination of the weaknesses on the part of participants. It also motivates the participants, because if the participant knows that to how much extent he or she is working and to what extent he or she has achieved goal, then she can be motivated or he can be motivated that 50% we have achieved, only 50% is remaining. So the clients can be motivated through the evaluation. If there is no evaluation process, normally the client stucks at one place and progress cannot be seen or achieved. Next objective is to assess the effectiveness of the program. That program is effective or not for the community people or for patients or the nursing process. To modify or continue the plan for the patient care program or activity. If we are evaluating and we can find that yes, this program is well or good for the client, going well, then we can continue the plan. Or sometimes we find that there is no benefit or we are not achieving our goal, then we can modify the plan. So again, continuous evaluation is essential. And another important objective is to promote quality improvement in the patient care or program or education system. Now we come to the process of evaluation. How we evaluate? Evaluation process involves the following steps, and it starts from identifying the purpose of evaluation. Why we are evaluating? We have discussed 6 objectives, so one or more objective we can consider and then we can start. Then we identify the time frame, that in how much time we have to cover the evaluation, determining when to evaluate, ongoing evaluation or the evaluation in the mid of activity or at the end of activity. This we can decide. Then selecting the evaluators, who will evaluate. Okay, so supervisors or evaluators we select and then we ask them to do their work. Finally, choosing an evaluation design, frame or model. So by which system we are going to evaluate. And very important, selection of instruments or tool. What tools we are using for the evaluation. After selecting the tool, we collect our data, that is known as data collection, and after data collection, we interpret these data, and through interpretation we can find out, interpretation or analysis, we can find out the result, and we report the result to the higher authorities. So this is the whole process of evaluation, and it can be applied everywhere, in hospital, in community health, and in nursing education as well. Now, types of evaluation. Types of evaluation depend upon the object or the activity or the program and the objective of the evaluation. There are 2 main types of evaluation: formative evaluation and summative evaluation. So now we will discuss them one by one. What is formative evaluation? Formative evaluation is an ongoing evaluation to measure the progress throughout the activity or the program or the course. It begins from that very initial moment when the program starts and it continues till it is finished or complete. And this formative evaluation give feedback at regular interval, and according to this result or the feedback, we can modify, improve our activities. This evaluation enables the participant or staff to adjust the activities in accordance with the progress made or lack, if it is there. It should in no way be used as to certify or final judgment of the evaluation, because it is just to support and to improve the activities. Another type of evaluation is summative evaluation. It is final evaluation in terms of achievement of the objectives, and it is carried out at the end of the activity or the period of instruction or the program for giving result or certification. It describes the extent to which the program has attained its objectives. It provides guidelines for the decision and further course of action. It is the final result of evaluation which can be submitted to the higher authorities. And now we will discuss the tools of evaluation. What are the tools or instruments for evaluation? Selecting tool for the evaluation depend upon the type of evaluation. For obtaining necessary information, various type of instruments or tools can be used. For example, to find out or to evaluate our students, we use questionnaire. Apart from this, another tools can be used: rating scale, attitude scale, where we scale from 0 to 10 to how much extent the client has improved or worked or achieved our goal. Out of 10, how much marks we can provide. Then checklist, yes, it is also very important, where we tick. Self-report or self-appraisal is also a process through which we can evaluate. We ask the client to give self-appraisal or write a self-appraisal report, and then we can evaluate that report. And of course, what records and reports are maintained by the client. Through these records or reports, we can evaluate the progress of the program or activity. Checklist is, I think, most important and widely used for checking the program or for evaluating. It can be used to evaluate any activity, skill, attitude of the staff or the program. It can be developed by the supervisor as per the needs of the program or the activity. Here we have taken this example, checklist for supervision for the LHV. LHV will supervise ANM during home visit. So what point we can write here, that for example, name of the worker, then post ANM, or ANM can supervise ASHA, that can be done, then department or sub-center, and date and time. Now here there are 5 points: excellent, very good, good, fair, and poor, and here we tick. Under approach, the attitude, if it is excellent, then we tick here, if it is good, we tick here, and if it is poor, then we tick here. And in the same way, these are the activities: knowledge and skill, health education, how she is providing health education. And after completing this tick mark or checklist, we write total score here, and then we also give remark and supervisor signs here. So this is an example of checklist. You can prepare your checklist as per need. Thank you, students. Have a good day.